autoimmune disease is a very, very serious thing. And I see this every day in my patients. Besides, yesterday I had a very, very sick rheumatoid arthritis 53-year-old patient, and I was just devastated for her. I told her, enough is enough. Do not be living like this. You have you have the ability to heal. Stop already. Stop this madness. And there is hope for you. I gave, of course, the website of Victoria and Oksana, and I said, get out of this kind of life. You have the ability to get out of this kind of life. And then last week I had an ulcerative colitis, a 28-year-old patient, and I also told her, you need a life. You can't be coming back to the hospital twice a week just because of this ulcerative colitis that is ravishing your body. And there is hope to heal. That is very easy to heal. Your ulcerative colitis is just basically an inflammation of your colon, and that inflammation can be healed. And I am seeing my patients, they are just so ignorant. And just like me, I was so ignorant too. I am the very first person to have autoimmune in my family. I had no idea. I did not even know what Sjogrens is spelled, how Sjogrens is spelled, and I had no idea what autoimmune is. I've always been scared of autoimmune because can you imagine your antibodies fighting your own antibodies? That is really, really bad. But here's the thing. Here's the big picture for us. 5 years from now, your brains are only going to get worse. 10 years from now, your kidneys will already give way. Your liver is already going to give way. They are not going to function anymore, especially if you are going to start using the normal medications. Like for me, I was given gabapentin, I was given hydroxychloroquine, which is a treatment for COVID actually, and I was given cevilamine, and I'm looking at this and I see these drugs. I give these drugs to my autoimmune patients, and they do not have a life. They are basically like dead people on earth, like walking dead people, because they are dependent on dialysis. They have liver transplant already, and their second liver transplant is dead, and or they are waiting for a transplant. This is what's going to happen with us, because these medications are severely destructive to these primary organs. Guess what? Yesterday, when this arthritic patient was about to be discharged, the rheumatologist and the primary doctor was fighting because the rheumatologist wanted to reduce the steroids because it's ravishing her body with infections. And then the primary medicine was saying, we got to increase this because we need more of it because she has to fight the infections. And they could not come up with a final decision that would be the best for the patient. I was just so sad. And here I am administering the steroids of this patient, and I am telling her, this is not good for you. I am sorry that I'm giving this to you because this is your doctor's order, but because you have used this for 27 years, and this is what happens to your body. Her body was covered with sores. I did not even know that rheumatoid arthritis can not only destroy your bones, it can also destroy your skin. Every autoimmune disease is a skin connective tissue disease, and any part of your body that is covered with tissues, that is covered with muscles, will have an issue, and in the long run will eventually be attacked by your own antibodies, and also with your own medications. And that is just a sad thing. You are so trapped, and unless you really heal your cells, the cellular membranes of your body, which are actually the ones that are broken, and what this program is actually healing, there is no hope. There is really no hope. You are just going to be trapped in these areas. So so this is really good. This is really good. This makes sense. Repairing our cellular membranes is basic science, but it is the science that is needed for autoimmune. Find a best way to heal the root cause of your problem, the root cause, not symptomatic treatment. Really the root cause, the cellular level of your body needs to be taken care of.